Since the cases started increasing, there's been a lot of information that's not available. I think yesterday it was 169 cases that were where the state could not find out who the residency of the cases were. Is this a problem of not having enough contact tracers? There's been some reports in the press that the state is going to curb contact tracing.
The state is not stopping contact tracing. I have to tell you, I think there's some media organizations who have very misinterpreted what's going on. We are simply finding the priorities around contact tracing as the need and the demand grows so big. We're prioritizing those cases. The vast majority of folks are simply not picking up the phone. That's why I think it's so good that we're leaning on our providers to get the information out. You know, your doctor, you're more likely to pick up the phone from your doctor, maybe from the government. We're leaning on schools. Schools are doing a lot more of their own contact tracing because you're likely to pick up the phone from someone from your school or whatever it might be if your child was in a situation that required some sort of quarantining or provision. So I think by decentralizing it a little bit, it still allows a lot of the contact tracing to happen, even at a more efficient level, while the state is still taking the priority cases. But by no means is this state stopping or slowing down contact tracing. We're simply kind of readjusting and prioritizing as that need builds up. And we're bringing more and more staff on to handle that.
And I understand there's privacy issues. We dealt with this in March. We never got the answer of there was one person in a certain county who refused to quarantine themselves. They were one of patient 1, 2, or 3 at the very beginning. And we never actually found out how many people in that county contracted coronavirus from that person not following the guidelines of quarantining themselves. Where are the patient 0, 2, or 3 with this outbreak? We went from literally in a few weeks, 5 to 10 cases in Concord to 80. Unless no one is wearing their mask, no one is washing their hands, that just doesn't seem like a realistic type of thing to happen. Was it all of the youth hockey players just passing on exponentially 5, 10 people getting sick from each one of those hockey players? What exactly started this ramp beyond just there's community spread in the state?
So I'll take that. There's community spread in this state. There is no patient 0 in this second surge. Every single state in this country is going through exactly what we're going through. Virtually no one is immune. So it's happening everywhere. It's happening in so many different areas, and it is happening all at once as a lot of these factors that are out of our control, whether it be weather or folks coming indoors, congregate settings, whatever it is, a lot of factors are coming together at once. Not in New Hampshire, not in Concord, but frankly all across the planet. If you see the surge that happened in Europe, virtually every country in Europe went through their second surge recently. And again, if you look at the rates of increase in virtually every state, they're all like this, right? Even the first surge, some had a surge, some states didn't, some were steep, some were not so steep. This one's very different. This second surge is very different. It's a lot steeper, it's a lot bigger, it's everything, frankly, unfortunately, that we anticipated.